Well, the most important thing when somebody thinks that they're having a stroke is that they need to call 911, because we have EMS providers who are very highly trained to recognize stroke, and they actually alert us on the way in so that we're prepared and we're ready for that patient when they arrive. We do a CT scan, we do a CTA, and then we also look at CT perfusion. They look at those images, they do a clinical assessment, and then based on putting those two things together, they determine whether or not they believe the patient's having a stroke. You know, there are two types of stroke. There's the bleeding type of stroke, and then there's the type of stroke where you have actually a clot. And so if they determine that it's the bleeding type of stroke, then we consider neurosurgical consults and see if there's something that we need to do there. If it's the other type of stroke, the one where you have a clot in your brain, then they consider whether or not that patient is a candidate to receive our clot busting medication, or if that patient is a candidate for what we call a mechanical thrombectomy, and that's where we take them to our neurointerventional suite, and we have highly trained physicians there who are able to go in and actually remove that clot with a catheter to be able to restore blood flow to the brain. Some patients are a candidate for the clot busting medication. Some patients are a candidate for the removal of the clot, and some patients actually are a candidate for both therapies. And so they make that determination, and then everything moves very quickly from there so that we get the patient the right type of treatment. So recovery from a stroke looks different, I think, than what most people think that it looks like. But the fact is, if you recognize signs and symptoms of a stroke and you get treatment in a timely manner, then we actually have really good success with treatment and with rehab. And so one of the most important things is call 911, get to the hospital, get treatment. But once you're here, we really look at how can we maximize the medical treatment that we're giving you, and how can we send you home on the appropriate medicines so that we prevent you having a second stroke.